We'll get started. Thank you everyone for joining the Community Champion Learning Collaborative today. We'll just go over a few housekeeping. My name is Sinova Hackman. I'm the program coordinator for the Delta Regional Community Health Systems Development Program with the National Rural Health Resource Center. Welcome you all today to this learning collaborative. So when you call in your phone line, it will be muted. To unmute or remute your individual line, press *2. Once you call in, please keep your computer speakers on mute to avoid any echo or feedback. You can communicate via the chat box at the left-hand side of the screen, and we will go over any questions at the end of the presentation. The file share box, which is located directly below the chat box of the webinar screen, contains a copy of today's webinar materials. When you click on the name of the file in the file share box, you can then click on the download button to download that file directly to your computer. There will be a few pre- and post-polling questions throughout this webinar, so we'd really appreciate just answer each of the questions to the best of your ability. And today's webinar will be recorded, so once the link to the recording is provided, we will upload it to the website and send that out to each of you guys as well. So before we get started and before I turn it over to Selena and the polling questions, we'll do just a roll call, and you can go through your name and your hospital, please. The lines are muted, so press *2 to unmute the lines. County Medical Center.
This is Patricia Ilelia.
Judy, are you on the line? Catherine, are you on the line?
Hi, this is Catherine with Drew Memorial.
Hi, Catherine. All right. Thanks for chiming in.
I had a hard time getting my phone to unmute. But
Yeah, no, it's okay. Yeah, the *2 to unmute. That one can get you sometimes. Taylor, are you on the line?
Hey, this is Taylor with Pickens County Medical Center, Carrollton, Alabama.
This is Tracy at Tippah County.
Hi, Tracy. Thanks for chiming in. All right. I think Judy, did you get on the call?
Hi, this is Jackie. Did you get me?
Yes, I did get you, Jackie.
Okay,
yes,
great.
I did. Thank you for chiming in, too. All right. Well, we'll get started. Before I send it over to Selena, we're going to do a pre-polling question. As I said before, just please answer it to the best of your ability, and then I'll send it over to Selena. You can just click on the, yep, okay, there you go, on the equal of those dots, and that'll record your poll. I'll give you a couple more seconds before I switch it over to Selena. Great, thank you for putting in your poll. Now I'd like to turn over to Selena at the National Rural Health Resource Center to get us started.
All right, good afternoon. This is Selena McCord with It's so great to hear you all participating in the webinar, Learning Collaborative. I see there are a few people on the line. Well, I noticed there are a few people on the line, but I don't see everyone connected to Adobe. So if possible, could you please sign into the Adobe room so that you can see the presentation? It will be very helpful for you today. Excuse me. So it's important that we pause for a moment and just acknowledge the program supporters and partners, the Delta Regional Authority and the Health Resources Services Administration's Federal Office of Rural Health have partnered to support the Delta Region Community Health Systems Development Program. And it's through the cooperative agreement with the federal office that the center administers the program and manages the provisions of services to the selected hospitals and communities. The purpose of today's webinar, we designed the webinar to provide your community champions with knowledge and skills on data collection to help tell a story on how your organization's participation in the program has impacted your communities. It's also to provide understanding of community champions' expectations in helping to measure program impact. So you may be wondering, okay, why evaluation? Why do we need it? Why is it necessary? As a program that is federally funded, we are expected to demonstrate value of the program and indicate how its activities have impacted the communities. It's also important we do evaluation to ensure programs such as this one are supported in years to come. We have to be able to demonstrate the impact and value relative to the dollars and resources that are being invested in the program. Program evaluation requires showing how effective and efficient the activities are in utilizing limited resources, improving program services and delivery of technical assistance that we provide through the center, and showcasing hospital and clinic successful strategies towards community care coordination. As champions, your role in participating in programmatic evaluation activities include assisting your leadership team in post-project follow-up activities, which include data collection and tracking and reporting of measurable outcomes. It also includes identifying community care coordination project metrics to track for helping to measure impact, and communicating with the center staff to share progress on those selected project metrics. Your role is key in this project, and it is our goal to make sure that we provide you with the necessary tools, education, and resources to assist with program evaluation. So with that being said, I want to turn things over to our guest speaker, David Mark. He is a professor of health informatics at the College of St. Scholastica. David Mark, I'll turn it over to you.
just a reminder, *2 to unmute your line.
All right, can you hear me now?
Yes, we can.
All right, thank you. All right, so thank you, everyone. My name is David Mark. I am the chair of the Department of Health Informatics and Information Management at the College of St. Scholastica. My background is in health informatics, and particularly related to data analytics. And I'm happy to share with you some information about how you can create more meaningful stories with data and also assist you in selecting appropriate metrics and measures when you're thinking about evaluation. So what is the overall goal of my talk today? I'm reading this right now, and it's not very clear. It's communicate with data. And I could see how there's a semantic issue here because I could visualize myself in a room just talking to my computer, talking to my data. That's not what I intended for this to be interpreted. What I intended for this to be meant as is to utilize data to assist you in communicating an effective message. And that's our intent. That's our overall goal today. So hoping to share with you some ways that you can be more effective when trying to communicate a message with data. So I'm going to start by telling you a story. And this story is using data from the county health rankings data that's available online. It's data that's collected on every county in the United States related to various health metrics. And here's the story. In Jefferson County, Arkansas, 7% of the population is uninsured, with an unemployment rate of 5.2% and 81% graduating from high school. 42% of adults are obese, 22% of adults smoke, and 18% of the population have diabetes. The average life expectancy is 73.1 years old. All right, so reflecting on my story, did this information that I presented, did it allow you to derive knowledge, or can you make some decisions off of this information? So just think about that for a moment. Can you create some decision points or make a decision from the data that's being presented? You may have had some issues, and the reason is that the story, it's inherently flawed. One of the issues is there's no real objective to the story. Why am I presenting you with that information? Also, it would be useful if you, rather than just being presented data on Jefferson County, that you could compare Jefferson County to other counties, potentially in Arkansas, other counties across the United States. Also, I just presented you the information in just a sentence structure. There may have been a more meaningful way I could have presented this data to get my message across. So let's try it again. Let's say the purpose of presenting this information was to investigate whether there is a need for a diabetes education program in Jefferson County, Arkansas. So we can see that the Jefferson County diabetes prevalence is at 18%. So 18% of those adults that reside in Jefferson County have diabetes. If you look at how this ranks in the state of Arkansas, first in terms of the county that has the highest prevalence of diabetes. The adult obesity rate is 42%. This ranks fourth in the state of Arkansas, while the uninsured rate is 7%. This ranks 70th, meaning that in terms of diabetes and obesity rates, Jefferson County has very high rates. However, in terms of where uninsured rates fall in Arkansas, we see that much of the population has insurance. If you look over at the map, you can see where Jefferson County is located in Arkansas, and you'll find that this map shows you the percentage of the adult population that has a BMI greater than or equal to 30, which is an indicator of obesity. And we find that Jefferson County has that darker shade of blue, indicating a higher obesity rate compared to other counties in Jefferson County. Now, using this information, do you think there's enough here to allow you to determine if a diabetes education program in Jefferson County would be something that could be considered? Probably, right? We find that there's definitely some opportunity to decrease the diabetes rate, and there's high risk of that diabetes rate increasing due to the high obesity rate. And given the fact that much of the population does have insurance, this may provide an opportunity to actually intervene with a population that has access to medical care, medical services. So with that in mind, you can see how the presentation of data matters. The way you frame your objectives matters. And this is why when you're communicating data, it's as though you're telling a story. So you should always strive to create a story with your data. Don't just measure something for the sake of measuring it. You should have a clear intent and purpose. Yes, we can measure the life expectancy for the people that reside in Jefferson County. But is there a purpose for why we're presenting that information? There should also be a clear start and an end to your story. Draw upon data and measures that are going to allow you to support a decision relative to that data that you're presenting. Make it concise. Make it clear. Data visualization certainly can help in communicating that story effectively. So use graphs, use tables where necessary. And if you have a few minutes, I have a link to a YouTube presentation. I won't play it here right now, but if you have a few minutes, I encourage you to take a look at this. This is a YouTube video that is of a TED Talk where a data analyst is looking at data in New York City to better understand important impacts on the residents of New York City. That might be something that the city of New York City would want to intervene with and make some important decisions, for instance, around how they around parking tickets and where they put signage for certain laws for parking on certain streets. When we're communicating with data, there's a foundational aspect to how that data is generated into knowledge to support decision making. Data is at the base of that foundation. And when that data is presented, it can result in information, which then results into knowledge, allowing one to create support decision making. So let's just look at the most basic level of data. So data is the most basic level. It's the bits of something. Here's an example. An example of data would be 4.21. That alone may not be enough to derive information from that, right? So let's add a little more context, 4.21 liters. All right, that alone, still we're falling short of having enough data to derive information. We don't know what 4.21 liters are what this is a measure of. So data is just a general idea. It has no relationship to anything else. By itself, it may not be most meaningful. For example, just showing the obesity rate in Jefferson County wasn't very useful. It wasn't until we could compare it relative to other counties that it became useful. Information is a higher level than data. It's data with context, meaning, and potential. Here's an example. Mr. X had a forced vital capacity of 4.21 liters on January 21st, 2016. Now, this idea has data that also includes relationships. We know what 4.21 liters represents, for whom the data is being presented for, and the date for which it was collected. The highest level of information, knowledge is a higher level. It's higher than information. It's higher than data. It's information that we put into practice or use. For instance, Mr. X falling VFC levels may be indicative of a lung function problem. So now we know that based off of the information that a lung function problem may be occurring with Mr. X. So it's an information that can be internalized, generalized, and inform decisions or actions. So maybe we need to do something to intervene with Mr. X's falling VFV levels to prevent a severe lung function problem from resulting. So our intent when we're working with data is to move along this continuum from data to information to knowledge. But how do we do that? So as we move towards a better understanding of the problem, that's when we're moving across that continuum. We need to clearly determine who the we is. When you're working on your various projects in your communities, the we, identifying that we is very critical. We also need to identify the data that we're going to use. This is oftentimes done by a collaborative effort. It's not just you sitting in isolation, but working with the various stakeholders to ensure the data that's being used is the most appropriate. We also need to create a story from that data that translates into something meaningful. That data is the source of truth, and any analysis that we perform is going to allow us to progress along this continuum. So therefore, the quality of the data you're working with, where that data is coming from, if the data that you're collecting is truly related to the question you want answered, those are important factors when we're considering how to utilize data, how to create stories that are meaningful from the data. So now I'm going to talk a little bit about measurements. Data can lead to information and knowledge by telling a story using measurements. These are the things that we're collecting and reporting out on. But who really cares, right? Why do we care so much about measuring things? Well, telling a story with metrics, with measures, it can impact the behavior of people. Therefore, deciding what we measure and how we choose to measure it, as well as how we communicate the results of those measures, that's how we're going to continue across this continuum from data to information to knowledge and ultimately impact the decisions that are being made from that data, which can, in the end result, improve outcomes. It can improve your approach. However, recognizing that any measure that you use, it could be inherently flawed, that's actually a healthy place to start, because you can walk through anticipating some of the issues that you may have with the measure in hopes of getting to the highest quality measure that you can utilize to ensure that any decisions that are being made, any knowledge that's being derived is correct. So you need to ensure that any measurement that you select, you're choosing that measurement with care. And it's using an approach where you're engaging various stakeholders in that selection is a critical aspect to that. So let me pose a measure. So let's say we're interested in collecting information on cigarette smokers. So we need to identify who we're going to be collecting the information on. So if we ask for data on smokers, is that the data we derive just from requesting that, will that be the same information, same data that we gather when we ask for data on people that smoke 1 to 3 cigarettes per day? What if we ask for those that have a history of smoking or previous smokers? What about those that smoke 1 pack per day? What if we ask for data on tobacco users? Every one of these requests is going to lead to obtaining data that's slightly different. This is where the lack of specificity can be lead to issues with clearly understanding and defining the data that we have. Therefore, when the underlying attribute associated is unclear with regards to what we want to measure, this could lead to challenges with actually developing a meaningful metric. And if our metric isn't meaningful, if we're not considering where are the weaknesses of our measures, that's going to inhibit us from being able to move along that continuum so we can support decision making. Healthcare, it's a complex socio-technical system. A simple metric can mislead if there's not an adequate consideration of the context of just how humans make decisions. This is where having conversations with people, really being that devil's advocate when approaching how to measure something, how to utilize those measures to derive information and knowledge to support decision making. It's important to be critical of what you're proposing. I'm going to cover a 4-step process for how do you effectively tell a story with data. We're going to start by talking about how to pose a good question. That's a foundational component of developing a good measure. You have to have a question first. From that, we're going to define a measure that we can use to answer our question. Then we need to find the data that we're going to utilize to calculate our measure, to answer our question. And then lastly, develop a way to create a meaningful message. How do we effectively answer that question that we originally posed? Let's start with the question. When we create a question, we need to determine what questions we need to ask what question we're hoping to answer with the data. So one thing when referencing or trying to format a question is you try to avoid anything that's overly complex. So there's too many elements to your question. It probably is best to break that down into more than one question. So you don't have to combine everything into one question. You could have many different questions with many different measures behind that question. Keep in mind that what you want to measure and what you want to compare, and try to capture those two elements in the question that you're posing. So I'm going to give you an example. Here's I'll frame it as it's not a horrible question. It just could be, there's opportunity for improvement. So here's a question. Are hospitals impacted by patients diagnosed with mental health disorders over time? That question, it may seem entirely reasonable, but there's a problem with this question. First, how are we defining patients? Are we defining all patients, specific patients? Are hospitals impacted? Is this just one hospital? Is this more than one hospital? Mental health disorders over time. Are we specifically identifying only some mental health disorders or any mental health disorder? And over time can mean any number of things. Should we limit it to a specific time frame? So I'm going to rephrase this into a better question that gets to the heart of what we're trying to ask. A better way to phrase this would be, is the percentage of patients admitted to the ED with mental health disorders different across the past 6 months? So when I ask this question, you likely can start to visualize what the data will look like. If you can think of a picture that you can draw in your mind to answer this question of what the results would look like from the answer to this question, that's an indicator that you're on the right track. That if you can visualize what the data is going to look like, well, your question was probably phrased in a way that it makes sense. So that's one thing to try to do. Create a picture. Try to simulate what your results are going to look like just by drawing it down on a piece of paper or doing it mentally. The next thing we need to do is define what you want to measure. Now, not every measure has these two things, but most do. Most have two variables. They have a dependent variable and an independent variable. Now, you may never remember these terms, dependent, independent variable, but here's the important things to remember. A dependent variable, it's the thing being measured. So an example would be the total cost of transports, the number of ED patients with mental health disorders. It's typically something you're counting, you're calculating, you're collecting data on. It is that thing that's being measured. The independent variable is the thing being compared. So when you have your dependent variable, it's the thing being measured, you oftentimes want to compare it against certain factors, a different variable. For instance, maybe you want to look at how that measure changes over time. So time could be your independent variable. It's the thing you're comparing. Maybe it's comparing a measure before an intervention and after an intervention, so pre-post treatment. This would be an independent variable. Maybe you're comparing something in obesity rates in Jefferson County relative to a different county in Arkansas. Your dependent variable would be the obesity rate. The independent variable would be the counties. The dependent variable is oftentimes compared across each level of the independent variable. By considering these two variables, it's going to allow you to create measures that are not only going to allow you to develop some information from them, but also can be compared against different factors, such as time, such as pre and post, such as between counties, that allow you to create more meaningful decisions around any measure that you're collecting. So let's look at a few examples of how we can define what we want to measure. Let's say our example here is we want to decrease the number of emergency department visits with a behavioral health diagnosis in the next 6 months. So if we were to identify the dependent variable, the thing we're measuring from this example, what that would be is the number of ED visits. That's the thing we're measuring, the number of ED visits. The independent variable is the variable that we're using to compare the dependent variable across. So the independent variable in this case would be time, the months. So in the next 6 months. Now there's some considerations that we need to take when we're thinking about this example. One thing is we need to define what an ED visit is. How do we define that? We also need to define what a behavioral health diagnosis is. Are we looking at any behavioral health diagnosis? If so, how do I identify that the people, the patients being seen in the emergency department are those with the behavioral health diagnosis? Is a count an appropriate metric? Should it be a proportion instead? This is an important consideration that we're going to think a little bit more about. When we're thinking about counting some data, you're oftentimes, doing something like counting the number of patients, counting the number of days, counting how often an event occurs. However, if you were to frame that in terms of a proportion, then you need to define that data in a different way. So this would be where you are looking at how often a value occurs because it's a part of a whole. And to calculate a proportion, you need a numerator and you need a denominator. So our previous example was to look at the number of ED visits with the behavioral health diagnosis. But what if we instead frame this as the proportion of ED visits with the behavioral health diagnosis? If we were to reframe this question in terms of a proportion, our numerator is that top number of the fraction. It's the total number of ED visits with the behavioral health diagnosis. Whereas our denominator is the whole. It's the entire observation, which would be the total number of ED visits. So what we can calculate here is a proportion. Maybe it's 0.25, which would mean that 25% of the ED visits have a patient with a behavioral health diagnosis. Whether you report the data by counting a measure or reporting out the proportion, it can greatly impact the interpretation here. See my graph, one of them didn't turn out too well here, but I'll walk through it anyway. So note that we have in the table off to the left-hand side of this slide, we have ED visits with the behavioral health diagnosis, and then the next column over we have total ED visits, and then the next over we have proportion. So in January, you can see we had 60 patients with an ED visit. Then it went up to 65. In February, it went up to 70. In March, down to 72 in April, 78 in May, and so on. So looking at this data, it would appear that in June, we actually have the highest number of ED visits with the behavioral health diagnosis. But if we were to think about presenting this data out as a proportion, so counting for not just the number of people with an ED visit, but also, well, maybe we just saw a higher number of ED visits with the behavioral health diagnosis simply because there were just more ED visits that month. So if we take that into consideration by calculating out a proportion, you can see that the month that has the highest proportion is actually April. So there are 41.1% of all ED visits had a behavioral health diagnosis. That would be 72 out of 175 ED visits had a patient with in behavioral health diagnosis. So notice how we can develop different conclusions from this data. We would, by looking at the count, we see that June there's a highest number of ED visits with the behavioral health diagnosis, but if we look at the proportion, it would be April. In June, we may have had a high number of ED visits with behavioral health diagnosis simply because there was a greater chance of observing that number because the total number of ED visits was so high. Now, which one's correct? Is it correct to present this data as a count or present the data as a proportion? Well, both are correct. It really just depends on the goal, the intent. If the goal is to understand of all the patients that come through the ED, what are our chances of seeing patients with behavioral health diagnoses? Well, then a proportion may make the most sense. However, if the intent is to look at maybe when patients with behavioral health diagnoses come to the ED, it results in a more need for resources, or you want to ensure that you have the appropriate staffing at any given time. Well, this would be maybe where the count of the ED visits of behavioral health diagnoses would be more useful. So it just depends on the context of the situation, as both approaches could be entirely appropriate. We need to make sure that we understand what we're going to do with that measure. So we can examine differences. So this is where our independent variable, we look at it based off of time. We look at differences over a period of 6 months. It might be pre and post. We look at a measure before we implemented an intervention and after. Maybe it's between groups. We look at a location A versus location B. Maybe it's, we also have to think about how we're aggregating that data. It could be based off of calculating a count or percentage, but maybe it's looking at an average or looking at the median. Careful consideration of these values and how that data is going to be reported out and how it's going to be compared is critical to developing a good approach to measurement. An example would be, maybe we want to look at decrease, if PHQ-9 scores are decreased upon a mental health follow-up. So you might want to compare the average differences in the PHQ-9 scores pre and post mental health treatment for each patient that is seen. So that would be an example, and we're looking at an average of the differences with our comparison being before and after an intervention. Be wary of always averaging values out, too. Just because you can doesn't mean you should. Sometimes values are reported out as a number. They're not really a number. So if I look at data on males and females, sometimes that data is coded as 1s and 2s. So if I calculate the average sex of the patients, and that is 1.46, does that make any sense? Well, no, right? Taking an average of the sex of the patients would not make any sense. Instead, an appropriate way of looking at that data would be to count the number of males and females, or look at the percentage of males and females. So just because it's a number and it looks like a number, it doesn't mean that you necessarily should treat it as a number. You also have to be careful with an average because it can be misleading if the data is skewed. And I like this comment here. It says, the data is also wrong. Can you average them? Sure, I can multiply them too. Just because you can doesn't mean you should. There's also no need to reinvent the wheel. Oftentimes, the data you're interested in, it's available and it can be repurposed. Other times, you need to collect your own data and develop your own metrics. So knowing where that data resides, it's a good start. We're going to think about both of these approaches. So let's talk about where the data is. So as I mentioned already, healthcare, it's complex. The data that you would use, it can be complex as well. It's important to determine if the data you want is from an internal or external source. So what I mean by that is the data you're interested in, does it reside within your organization or does it reside outside your organization? If it's inside your organization, this would be where you could work closely with your IT department and ask them if they could develop a query for you to obtain that data. So request that data from the people that would have access to it. You may, if the data is external to your organization, this would be where maybe you need to discuss this with your community partners to determine how that data can be provided to you. Maybe the data lives outside on the internet and there's various public sources of data that you could utilize. I presented one here today, the county health ranking data. That might be an appropriate source of data for you. It's important that whenever you're discussing the data that you want with the various stakeholders, you ensure that you're very clear on what you're asking for. And then when you get the data from whomever is supplying the data to you, don't just assume it's correct. Be a critic. Evaluate, look at row by row to see if the data that you have access to is truly representative of the information that you're trying to gather, and if it can answer the question you're posing. Now, I'm going to provide you with some examples of some measures that are oftentimes utilized in healthcare. We're going to be looking at 3 different measures. We're going to start with the clinical measures. Now, a clinical measure is typically a measure that evaluates a change in health of a person, a group of people, a population, that can be attributed to an intervention or a series of interventions. So here's an example of some clinical measures. It could be the rate or the count of a diagnosis. So it could be the percentage of the patient population with type 2 diabetes. Or it could be the use of a laboratory test. It could be the percent of patients with diabetes that are tested for hemoglobin A1C in the last 12 months. So these 2 examples are clinical in nature. We're evaluating the state of health of a group of people. Other possible measures are operational. These are measures that are used to evaluate an organizational unit and how well they're performing. So this would give you information about how that organization is operating and help you in deciding where there could be opportunity for improving those operations. An example would be patient wait times. This could be expressed as the wait time from when a patient checks in to an admission to an emergency department visit. It could be length of stay, the number of days a patient is in an inpatient setting. Maybe it's bed turnover, the number of patient transitions in beds or in rooms. All of these can be related to operations. How can that organization be more efficient? In financial measures, this is a measure of evaluating the financial performance or impact of an organizational unit. Cost is oftentimes at the crux of much of the financial measures. Treatment charges, for instance, on average, what is the amount of money a hospital is charging for a particular treatment? It might be related to claims processing time. On average, what is the amount of time an organization spends processing insurance claims? That one, it's both a financial measure as well as an operational measure. So you probably could have that one fall underneath both of those. But thinking about these various categories of measures can allow you to consider where are opportunities for actually measuring things. Should we measure those things related to the health of the people, related to how the organization is operating, or maybe the financial implications of those of that organization? Now, where the data resides really depends on what you're trying to do. As I stated earlier, sometimes it's internal and sometimes it's external. Some internal data sources you can see include the EHR, which is the electronic health record. That's a system that is being used to collect the patient information, among other data elements, oftentimes involved with the billing of services as well. Many healthcare organizations have a data warehouse where you can actually develop customized queries from the data that's being used. External data sources. Well, think about the Centers for Medicare and Medicaid, the Department of Health in your various states. Look at CDC. Look at county health rankings. Even look at your own counties as they may have data. The operational data, similar. External data sources would be like AHRQ and financial data as well. One commonality here is you see that EHR is listed as an internal data source for all. And this would be because the electronic health record is a source of a lot of data. A lot of data that isn't necessarily being used all the time as well. It includes demographics, medical history, information about the patients and their medical status. It has billing information, scheduling information, and a lot more. What's interesting about data in the electronic health record is a lot of that data can be accessed by developing reports. So reports allow individuals to basically request data from that electronic health record and then are returned with basically a spreadsheet of an aggregated view. So it could be the count of how often certain events are happening. It could be how much money is being reimbursed for certain conditions and so on. A lot of these, there's reports that are standard reports. These are things that are already being done with your electronic health record. It might be an electronic clinical quality management dashboard, a MIPS dashboard, an appointment report, billing report. There could be productivity reports. There could be any number of things. But EHRs can also support what's called customized reports in ad hoc fashion. So maybe there isn't a report that currently exists, but you want to be able to get data out of your EHR that doesn't necessarily fall in line with the current report. This is where you can work with your IT department to develop a customized report to access data that you would need that isn't currently part of an existing report. Now, sometimes it's not that easy, depending on the healthcare institution. Sometimes you're working as an affiliate of a different healthcare organization, requiring there may be some cost associated with ad hoc reports. So now I want to talk about translating data into a meaningful information. Now, when you have your data, you have it identified, you would know what metrics you want to utilize, you know what question you're asking first of all. When you're trying to translate this data into a meaningful information, really understand who your audience is, and first the purpose of your evaluation. So it's very important to know who your audience is. If your audience includes community members, well, you might want to avoid using a lot of technical jargon or utilizing a lot of medical terms. If your audience is individuals in the C-suite, like the CEO or CFO of an organization, well, maybe you want to look at more of the financial and operational measures that might be more of most relevance to that audience. Also, use space wisely. Most readers tend to read from the top left of a screen and then move on to the right and keep moving down. So it's important that you put the most important information based on where people's eyes are going to be directed to first. So try to put that information that's most important to span at the top of the report, of the top of your display, if anything at the top left of that display. Make sure you understand what type of device the viewer is using. So if there is printed off on paper, that's one thing, but sometimes it's being viewed on a computer or even on a phone. So you need to make sure it fits on the screen. Don't overcrowd the display. Don't put so much information on there that it's kind of mind-boggling to be able to interpret what's happening. But also, don't put just such little information on there that you don't emphasize your main points. Someone should be able to look at your graph or look at a series of graphs and really understand without much prompting how to interpret that data. If you can, add interactivity. So if you can click on a graph to get more information, that's great, but sometimes that's not feasible. Here's an example of the median time spent in an ER prior to transfer to inpatient setting in the past 6 months. And you can see that with that as a cue, you can develop some decisions from this data. So where there was the highest, the lowest number of median time spent in the ER. All right. A picture also isn't the preferred method. So I'm going to ask you 3 questions. So looking at the data on the left and the right, it's the number of patients admitted for 7 days. If I ask, what is the general trend of the number of patients admitted over time? You likely are looking at the graph. If I, however, ask, what is the number of patients admitted on day 4? Well, if you look at the graph, that task is going to become difficult. So you're likely looking at the table of data. If I ask what day had the lowest number of patients admitted, well, you could do this probably with either of the table or the graph. The answer, however, is a little tricky. It's 2 of the days. It's day 1 and day 5 have the lowest number. Don't ignore your intent. If you create a visualization that has nothing to do with your original intent, has nothing to do with the original question you had asked, it won't be very meaningful. Always ask yourself, why is this important, and how does it relate back to what I'm doing? For example, if your intent is to improve provider awareness, to improve referrals to mental health providers for care coordination, would you need to know the current number of referrals? Would you need to know the incarceration rate? You probably would need to know the current number of referrals, but you may not need to know the incarceration rate of those patients. It may be interesting information, but it might not be as relevant for the question that you're trying to have answered. So in conclusion, there are many different measures that you can approach. If you can consider asking a good question and selecting appropriate clinical, operational, financial measures, which are very common, that is going to be a good place to start. There are numerous sources of data that are both internal and external